Hello, everyone. So today here we are with myself, Dr. Farzana Khan, the Medical Director of the Women's Health Clinic, and one of our most senior colleagues in the Women's Health Clinic, Kira. Welcome, Kira.
Welcome.
So today we're going to talk a little bit about one of our most popular treatment called the NuV laser treatment, which is an intimate laser for vaginal rejuvenation. And Kira, our nurse, has been offering and delivering this treatment for many years within the Women's Health Clinic. So Kira, tell me a little bit about yourself.
Okay, so I'm first and foremost, I am a mum of 3 children, and I'm also a nan of 5. And I have 2 grandchildren. So I'm a mum first and foremost. I'm also a nurse for over 35 years. And as a woman with friends, obviously women's health is very important to me, and all those who are around me, not just professionally, but also socially. And so I, as someone who cares for family, I realise that it's important. Very often, women are the backbone of the family, and their health is so important for looking after the family, looking after their husband and their children or their spouse, partner. So it is essential that we're not forgotten. Ladies aren't forgotten. So
I really like that point that you're saying that ladies aren't forgotten, and that is why we're here today to talk about a subject that is often stigma and taboo. So women's intimate health is a great stigma, not only in the UK but across the world, and it's a topic that we don't discuss about commonly. And women's intimate health can be young women, does not necessarily only have to be menopausal women, and often is perceived that it's only older women. However, in our clinics, we see younger patients as well with lichen sclerosis that are getting treated with NuV. So tell me, Kira, from your experience offering this treatment, do you want to share some sort of success stories or how you felt that this treatment helped the women that you were treating? Any cases that you remember that you think was really, you feel that you really empowered that woman through the treatment?
Yes. Well, coming to clinic in the first instance is a big thing for many of the women, because often they are in pain for a long time, so they normalise their pain and think and just accept it. Some women feel embarrassed to speak to a doctor or to speak to someone about their intimate health. You get some who don't want to bother the doctors because it's a waiting time, and then you get some who think they're going to just be rejected. You get a whole cohort of people. When they actually come into clinic, the one what sticks out in my mind is a lady who was brave enough, after all the challenges, she had gone online and she had researched various things, and she had lichen sclerosis, a condition where she couldn't even sit down. She was in severe pain. She had itching. It affected her day-to-day life, her work. It affected her sleeping. So it became mental anguish. And the doctors was just saying, put a little bit of Vaseline, put a little bit of, wear a pad if you're leaking. Eventually she did get some steroid, but it was a vicious circle because the steroid was causing her skin to be quite thin, and then she would itch, and that would become excoriated. So when she came to me, she was totally excoriated. And my first session largely was just a case of listening to her, even giving her a hug, and just really letting her know that we're here to help her. She's going to get the help. And so a lot of people suffer in silence. So I was able to explain the process of laser, how it works, why it works, the benefits of it, some of the success stories, and really give her the if you like, a sort of summary of what the next step would be. So she went home. After a short time, I invited her back in. She got to know me. We built a little bit of rapport, and we had a bit of trust. So before starting the treatment, we applied the lidocaine, which was a numbing cream, which really helped, and I was able to do the first treatment. After following the first treatment, she saw results almost instantaneously. She came back and had the full course, and I would say it improved a fair deal, but because she was coming from somewhere really bad, it took a couple of treatments before now. And she now only attends annually. She's a different woman. She is full of life. She's no longer pessimistic about life or in internal turmoil. She is vivacious. She's just fun-loving. She's just happy. And that's why I'm in nursing, to really empower people, to let women be women and really give their best so they can be with their family and really embrace a family, as opposed to someone who is quiet and introverted and breaking down and not being heard or listened to.
Yeah, I think you made a really valid point. So on a daily basis, as the medical director and one of the senior leads here, I treat a lot of women with lichen sclerosis, whether it's a standalone with the NuV intimate laser or any laser for that matter, as well as combining it with PRP, which is platelet plasma therapy, or exosomes, which we are now also going to be doing. I think they are women that are often forgotten. Lichen sclerosis is a very disabling condition of intimate area. Men can also be affected, but as being the Women's Health Clinic, we are here trying to help these women. Box standard treatment, as you rightly said, are steroids. These are the recommended guidelines that we use steroid first. However, often these women are not finding the relief, and they are looking elsewhere, like they look us up and find out that it's going to help. We do know there's a lot of clinical data and scientific data out there, so we're not just offering this laser treatment because we think we should be doing that, but we're doing it because there's a scientific background and enough literature out there to see how it helps. I think what is really important to understand, obviously these are regenerative treatment, and you just mentioned they're coming for annual top-up, but what it does is it does keep the lichen sclerosis under control. It helps with flare-up. It's enabled them to wear tight-fitting jeans, cycling, horse riding, things that they might not be able to do because the lichen is so painful. So I think as a clinic here at the Women's Health Clinic, whether it's yourself or me or any of the other clinicians who are working, I think we're all here to see that we want to help these women and empower them through the regenerative treatment that we offer. So we're not only on NuV, we're obviously doing a lot of other treatments. What do you want to say? Because obviously I'm always very vocal and say, please do not be shy. You're not the only one. So for women out there who sat listening to us, who may have some intimate health issues, because there's also women who have had cancer. So they're also a big cohort of our patient who may have had breast cancer, gynecological cancers, who are struggling with severe dryness, and they feel like they have knives or scissors inside their vaginal, and they cannot be intimate with their partners. So we know that the NuV laser will help, whether it's given as a standalone or in combination. Obviously, we're always promoting combination therapies because we know there's a synergistic effect if we're combining laser with PRP or other modalities. But what would you say to women who are listening to us who may be thinking of coming or maybe shy and not know what to do? What do you want to say? How do you want to encourage them? With your 35 years of experience, because women are often worried that it's going to be really painful. They're always worried. I know you mentioned the LMX that you order topical. Sorry, LMX is the brand name, but any topical numbing cream that is applied. What would you say to women who are listening in terms of how painful it is, and should they be shy or should they come forward, and how easy is it to have a journey with the Women's Health Clinic?
Okay. Well, first of all, I would say that although I don't suffer with any ailments in terms of women's health, obviously I am empathetic, and so as a rule, all the nurses in the Women's Health Clinic has had the treatment. So whilst I didn't need it per se, I had it because I wanted to know what my women are feeling. It's no good promoting something if you don't believe in it fully. So I've had a couple of treatments, and so I can speak firsthand. That's what I'd say to them. I'd also say that it's obviously a confidential interview consultation. So this consultation with the women, they have our trust and our confidentiality. So we work with them. And because I've actually had the treatment, and I usually tell my patients that, or the ladies that, if they felt uncomfortable, you stop. But usually, because we have that numbing cream, they don't have that. But it's more a case, although the treatment's not uncomfortable, it's the fear of having that. So sometimes it may be that you have a consultation on the phone, and you get to know one another, and then they realise that it's somebody who has had the treatment themselves, understands, and is there to help them. And that's the important thing. They need to know that you're on their side. You're not just clock watching or ready to write a script when they come in. We are there to hear them. And, I have wept with them when they cry sometimes. Yeah. If they've gone through, if they've had things like FMG, female genital mutilation, or they've had any form of trauma, any abuse, we are there. We can signpost them for further help. So as a service, it's, sometimes you may not get it dependent on where you live, the postcode that you live, you might not get the support. But the Women's Health Clinic has lots of, understands that there are services out there which can help. So, as you mentioned, with cancer, somebody may have come in with an intimate problem, may have atrophy or something, but when they're talking, they may have another condition. And so we're looking at the ladies holistically. We're not looking at them just the private area. We're looking at them holistically. So we're giving advice holistically as a practitioner.
Yeah, I think that was beautifully wrapped up. I think that's what we are, the Women's Health Clinic. We're not only looking at one thing. We're looking at mental well-being and physical well-being. But it's important to understand that women's intimate health can have an impact on mental well-being, and mental well-being can also have an impact on intimate health. So it all goes hand in hand. And I think it's about all our nurses being passionate about the same sort of treatment and the message and the whole thing about empowering women and breaking that stigma and that taboo. And I think it's interesting you're mentioning about the treatment. I think a lot of our nurses have tried the NuV. The injectable treatment, again, I have tried myself because, again, like yourself, I do believe that whatever you're doing on others, if you're not really trying it yourself, I think when you're then treating them, it gives you that empathy feeling. You understand what they're going through, and they're not just a number. And I think a lot of our patients, they end up being patients that keep coming back. You build that relationship, and they're seeing the same practitioner if they're in that area, which is what we're all about. So thank you so much. You have a final comment?
Yes, actually, I thought I was I had no issues in regards to the women's health. After having had the treatment, I realised that I was able to hold my urine much longer.
Yeah.
So before it was, I see a toilet, I had to run.
Yeah.
So the urge incontinence, I didn't think was an issue because I'd go regularly. And since having the treatment, I wasn't really expecting anything, but I realised later on that it did work because I was able to hold it longer. So I tell them it worked for me. Yeah. That's the other thing. Yeah, I forgot to say.
Yes, so if you guys are feeling inspired or feel like it's time to break the stigma or taboo, please follow us on social media, Instagram, Facebook, the Women's Health Clinic, or find us on the net. So it's the Women's Health Clinic. We'd be more than welcome to support you through your journey on women's intimate health, because no problem is too big to be solved here.
Correct.
Thank you.